Great. Welcome, everyone. This is the OCFSN, or Oregon Community Food Systems Network, VeggieRx quarterly meeting. And we have some great news to share, some updates, but wanted to first start and see if folks had any celebrations they wanted to share with the group. And I invite you to either use the chat or unmute yourself to share anything going on in your world, in your program, or in your part of the state that you wanted to share out with folks. Don't be shy either. This could be something very little, like, or seemingly little, that you got a food box out to someone this morning, or which is not a small feat. Don't make me, or it's a big feat. But anything you want to celebrate, it could be related to a VeggieRx program. It could be related to something else going on in your work or personal world.
I'll give you one, Kaylee. We served over
Thanks,
100
Megan.
people in less than an hour yesterday at our free fresh food market at Randall Children's. It was insane and incredible. And we need money to support our other ongoing food efforts. So joining the club with all the rest of you.
How many people was that, Megan?
Over 100.
Congratulations.
Thank you.
That's a wonderful celebration. Anyone else want to share something that they're celebrating, something they might be proud of, or you're happy to share a challenge that's going on in your world, in your work right now?
I could share one work update is that we're about to launch this, what we're calling the Food for Health Network, which is a network of local food pantries in the Tri-County Metro Portland region that will be able to deliver food to people's homes right when they get home from the Children's Hospital.
Wonderful. That's a really exciting update and exciting plans for the future here. Great piece of access there. And welcome if you're just signing on. I apologize about the Zoom link and switch over to WebEx. We're just rolling with the punches this morning and trying to convene folks. So if you're new to the space, welcome. You're on the VeggieRx OCFSN quarterly meeting, and we're just sharing out some celebrations or challenges or things that you want to share with folks. We were going to do this one-on-one on a breakout, but I am not seeing how I can break people out into rooms in WebEx. Claire, Theo, if you have that expertise, happy to still do that, but we can also kind of move on to other things too.
I wish I had that expertise. I don't. The thing that I've been focused on this week that's a success is the first day of school was yesterday. And for my child, he's a fifth grader at Bridal Mile. Go Beagles. So yeah, that's a cool thing. Good to see you all.
Thanks for sharing, Theo. It's an exciting first day. I ran past a house the other day and saw somebody taking like first day of school photos, and it's always an exciting time. Great. Well, I'll share. I'm Kaylee Summers, she, her pronouns, and I am just excited that everybody found the WebEx link and we are here in the space together, and hoping that maybe some other folks are able to see that email and trickle on here. So for the rest of today, I did want to introduce new steering committee members and kind of the structure of what we're seeing this VeggieRx working group within OCFSN, give you some updates on the Community Capacity Building Fund award that OCFSN received from 2 different CCOs and what we're now thinking around the HRSN, or Health Related Social Needs Food Provider Learning Collaborative. And if someone has a better, shorter name, also up for any ideas here. And then kind of talking about the rest of the 2024 year and what we want to collaborate on, what kind of resources and goals we want to work towards as this working group for the rest of the remainder of this year, and then looking into 2025 as well. So to start out, and please feel free to raise your hand or unmute if you have questions, and or use the chat format too. And if you are new to this group, or if you're not new to this group and you still want to put your name and pronouns and introduction in the chat, that's another great way to just see who all is on the call, and to connect with each other in that way too. But to start out, I wanted to introduce, we have 3 new VeggieRx Working Group steering committee members. And we have Claire and Theo on the call today. If you want to like give a little wave to everybody. So Claire and Theo and Trin, who wasn't able to join to this morning's call, but they have graciously volunteered their time and expertise and skill set and ideas to help kind of continue to facilitate this working group. And some of you who have been on these calls for a long time know that I've been holding this facilitator role for many years now. I am not leaving by any means, but I felt like it was a good time to ask for additional support, to find co-leadership in this space, to drive this work forward into the future. And I think that it's always a good idea to have more minds on things and more support. And I love the idea of co-leadership. And so I will still be here with Claire and Trin and Theo, but also kind of helping hold some of the leadership around this too. And I don't want to put you on the spot, but I would love if Theo and Claire, if you want to give a little introduction to yourself and why you're interested in helping support the OCFSN VeggieRx Working Group into the future here.
Sure. Good. Okay, I will go first since I'm off mute right now. My name's Theo Lada. I use he and him pronouns. I currently I oversee the health equity program for OHSU Health Services. So that's the IDS, Integrated Delivery System, as well as the Clinically Integrated Network, the CIN. So that's the Medicaid, Medicare side of OHSU. So we have right around 57,000 members within our for the lives that we're responsible for. So I'm also their tribal affairs advisor for those 2 programs in OHSU Health Services generally. My expertise is in research-based psychology, so that's I'm a researcher. So when I kind of got more interested in food as medicine or culturally palatable meals, I was speaking at America's Physician Group, and I heard Dr. Gupta, who's a researcher and a physician out of UC Davis, talk about culturally palatable meals and all of the things they were doing with health equity, combining food as medicine, combining different approaches within California. I was like, oh, that's cool. I wish the state of Oregon had something similar. I wish the state of Oregon took food as seriously as other states. And when I talk to physicians, they wish that they could prescribe food, right? So like food is a huge thing that's interesting to me. Most of my research has been focused on Indigenous folks, health equity, and policing. So Indigenous interactions specifically with policing. But viewing this as a pressing issue, I think that it was a good idea and seemed like a fun thing to focus additional research and resources and health equity approaches and the integration of traditional health workers and community health workers and peers with food. So that was some of my interest, and I'm happy to be here, happy to answer questions if that's useful. But yeah, it's nice to meet you.
Jump in next. So my name is Claire Londigan. I use she, her pronouns. I work with Oregon Rural Practice-Based Research Network at OHSU. And I've been on and off the last few years while I was in grad school, and then giving a little bit more health-related social needs benefit piece of the 1115 waiver when that was first rolling out. I previously operated a VeggieRx program in Vermont a number of years ago now, and I am really interested in the opportunity to kind of divert some healthcare dollars that may have been spent otherwise on pharmaceuticals to local food systems. And I'm especially interested in, both the direction that the kind of HRSN benefit will take some VeggieRx programs in the state, as well as the needs of the others that are not engaging with that kind of insurance, medical insurance piece. Did I miss anything, Kaylee?
I think that's great. Yeah, thanks, Claire and Theo. And like I said, Trin wasn't able to make it on today, but she brings a lot of wealth of knowledge in community work and farming, and has experience working with the Rockwood Community Development Corporation, where she was supporting BIPOC farmers in Boring, Oregon, and helping them kind of distribute their produce into school meals and farmers markets. And she's also very passionate about using food as medicine. And so you may see Claire and Theo and Trin sending out emails through this listserv, facilitating upcoming meetings, sending out other communication. So we wanted to just make sure that everyone was introduced, and also let you know I'm not moving to Tahiti, but I'm still around and still supporting this group, but really excited about kind of that co-leadership model and having even more support for everyone within this working group. So really excited for that. And if you're just signing on, I'm seeing some folks also putting in their introductions in the chat, and welcome everyone. Really excited to see everyone here today, and excited to talk soon about the CCBF award funds as well. I see some chatter about that too. So getting into that, we as OCFSN received funding from, or we have been offered funding through the Community Capacity Building Fund, which is coming through the 1115 waiver. If this is new and you're like, what are we talking about? Please put your questions in the chat and we can step backwards a little bit. But this would help support capacity building for organizations around the state that are wanting to become health-related social need providers. And specifically, we're talking about in the food and nutrition benefit portion of HRSN. So thinking about VeggieRx, medically tailored meals, pantry stocking, regular meals, and nutrition education that will become available to transition populations within the Medicaid population. So OCFSN was awarded funds through EOCCO, the Eastern Oregon Coordinated Care Organization, and through Trillium Health, which covers Portland metro area. We submitted applications also to HealthShare, Pacific Source, and Umpqua Health for other regions around the state. And heard back from HealthShare that we weren't awarded CCBF funds, but we are waiting to see if they've recommended us on to potential share funds, which is another pot of funding that is actually a little bit less restrictive on what it can be used for. But we won't know back about those share funds until mid to late November. We were declined funds from Pacific Source, and Umpqua Health is on a different cycle. So they're sending out CCBF awards in mid-September. So we should hear back soon if we were awarded funds then. I think we can all celebrate, and I see a little bit, you know, the Gorge Farmer Collective, congratulations that you are also recipients of 1115 CCBO or CCBF funds. So congratulations on that.
Thank you.
Yeah. And love to hear about plans around that. But to kind of finish up what OCFSN is imagining and thinking, we are right now in the contract phase of actually trying to receive those awards, and have come up with a little bit of a hiccup with Trillium around insurance requirements that we're trying to negotiate and figure out right now, and really crossing our fingers and our toes that that will go through. So once those contracts are signed and everything, really the purpose of these CCBF funds that OCFSN is receiving is to convene a monthly or bi-monthly learning collaborative with 15 to 20 plus CBO partners from around the state, even though the funds are coming from EOCCO and Trillium, which are two distinct regions. We've been clear that we are planning on opening this up to CBOs across the state, that we really want this to be a learning collaborative for everyone, regardless of what region you are, because we really feel like folks in the EOCCO region and the Trillium region will inevitably learn great things from everyone else across the state and share those learnings across regions. And that this is really the intention of this group, is really to create a peer learning space, that we know that there are webinars and things happening on the OHA level and some on the CCO level, but we really want to have a space where CBOs feel comfortable expressing concerns and challenges, and that we do have a ton of knowledge just within this group to share. We also realize that there may be some gaps in knowledge, and wanting to bring in technical assistance or other experts in different spaces or different topic areas. And so based on the needs of that learning collaborative, we'll identify some of those training needs and bring in those experts to this learning collaborative group. So contracting technical assistance support, also hosting other training that may be free, like around the community exchange platforms, or how you're billing for Medicaid, how you go through that process. We also really want to facilitate frequent bi-directional communication between OHA and CCO partners and the community-based organizations that are becoming providers of these services, to really update what's happening, what those challenges might be, and to advocate for improving those systems and procedures that are being built as we speak. Because we received reduced funding for these, we're still waiting to hear back on some of these funds. Some of the things that we originally put in this, in our applications and our proposals, was to provide individual TA support to organizations that are looking to do this, and creating more outreach and promotional materials across programs for more statewide communication around HRSN food nutrition benefits, and coordinating some of the translation of materials into multiple languages. So those are three areas that we hope to add in the future, but with the current budget that we have, we won't be able to do that right now. So in terms of breakdown of budget, we were imagining hiring a part-time coordinator. This would be a contract position for 5 hours a week, which really isn't a whole lot, unfortunately. But we're gonna make do for now. We also really wanted to make sure that within that budget, we were keeping to our promise of awarding funds to the CBOs, sorry, so many acronyms, CBOs who are participating, community-based organizations that are participating in the Learning Collaborative, to honor their time and expertise in participating in this group. And so we are depending on how many partners we bring on into that Learning Collaborative, how many people are interested, those pass-through funds to the organizations may look like anywhere from $1,800 to $2,400 per organization, and that would be for an 16 to 18 month period. We also wanted to reserve some funds in there for consultants. So as the Learning Collaborative identifies needs that we can't meet within the group itself, to bring in folks that can help train or speakers that can help move the group through some of navigating this process. And so depending on the number of consultants, that might be, different amount of funding around that. And then for OCFSN to hold some of this. Oh, great. Yes, Kira, that would be great. When you are able to hop back on, would love to hear more about Gorge Farmer Collective and what's going on. Thank you. And so a little bit of these funds would also go towards overhead for OCFSN to manage this grant and or these grant funds and all of that. Okay, I'm going to stop there, see if there are any questions or comments around this. I either confused people or said all of the right details and you're clear as crystal.
May have touched on this, Kaylee, but when will that work start? Or are you going to put an RFA out for that person who's 5 hours a week, or we need for 5 hours a week?
Yeah, so right now we are in that contract revision and negotiation with EOCCO and Trillium. Really the stumbling block right now is the insurance requirements for Trillium. And so we're working, the OCFSN Executive Committee or Board of Directors is working on that right now. And we hope to have that cleared up. I'm really hoping by the end of this week, if not by the end of next week. And so then those funds would come in early September. What we're thinking about is putting an RFP out for the first 3 months, so September through November, at that 5 hours a week for that coordinator position, to get things kind of set up, like the structure for this Learning Collaborative set up. And then we will know back from Umpqua Health and from Health Share around the share funds by the end of November. So then if we do have additional funding, then that coordinator position will hopefully, we'll bump up those hours and put another RFP out for a longer or bigger chunk of time and a longer chunk of time to cover the rest of that. If it comes back and we don't get any share funds and we don't get any UPQA funds, then that will remain at 5 hours a week, and we can, whoever was holding that for those 3 months, we would invite that person to extend their contract out from there or negotiate expanded hours and length of time on that. Because we realize like the 5 hours a week is such a short or such a small contract. And we didn't want to put that out for 18 months. And then if we increase that and the person that took that small job on isn't able to stick on for, anyways, there's a lot of back and forth around this, but this is kind of what we're thinking right now. But if folks have other suggestions or ideas around that, please let me know too. So sorry, let me go back to your original question too. 3 months, really setting this up, working with partners, what we're like in an ideal world, we would launch the Learning Collaborative end of October, early November, and start meeting probably twice a month with partners. And then as needed, either once a month or twice a month with the Learning Collaborative members through the rest of those 16 to 18 months. Yeah. And that might be like, we might bring on some partners and might bring on more partners, like as we reach out to more CBOs in different regions. So I don't imagine that we will start out with 20 partners to begin with, but we might, you know, as people are ready and want to engage in this work and hear about what's going on. We've also like someone from Rogue Farm United reached out recently and said that they received some funding to do some learning collaborative work in that area. And so I've been in conversation with other partners around the state that are wanting to do similar work. And how do we collaborate as like these other entities are also holding some of that learning space?
Yeah, well, congratulations, Kaylee. Thank you for I know you've been going above and beyond working for this for like a decade, just so everyone knows, garnering that statewide support. So thank you. Yeah, a couple of thoughts. I have held contract jobs in the past that were 5 hours a week, and I found it really difficult to hold a thread. It's just such a small amount of time. So just a couple ideas regarding that. I wonder about like shortening the length of the contract, because I feel like the big lift will be really over the next like 6 months. Because there'll be another call for grant applications for the HRSN capacity building support for organizations like the folks on this call, to make it like even just 8 hours, like 1 day a week. And then my other thought is just, hopefully Kara jumps back on, but some organizations have received other support through this funding channel or through grants for other funding, VeggieRx stuff. If we could add these 5 or more hours onto like an existing VeggieRx position, someone that has the expertise, and just weave it into someone who's already like really got their head in the game on this, I think that would be really helpful. And maybe you have someone in mind, or I'm not sure what your plans are, but just a thought, like if we could keep it in-house.
Thanks, Sarah. Yeah, we have talked a little bit about that. If anyone on this call does know of someone that, or that kind of structure of having another organization sort of house within another position to take on another 5 to 8 hours a week, please let me know, because we have talked about that kind of structure, but not really knowing who might be able to take that on, and also not wanting to put that on a CBO that's already taxed, and at capacity, and really isn't able to take that on. So we're trying to figure that out. So please, if anyone has any ideas of structuring this, but I do like what you're thinking around, like, okay, shortening the contract, but condensing the hours to upfront those hours in this time that it's going to be kind of a fast or feel like a really fast timeline to get more of the CBOs on board to be ready to provide services in the new year, at the beginning of the new year, really. Great. As people are percolating more questions or comments too, I did want to mention, so there's a lot of energy going into the HRSN work right now, but we also want to recognize that there are some programs throughout the state that are not, they're maybe wanting to step back and see what happens with this, are not really ready to engage in the HRSN work, or whatever their structure and goals are for their program. They really aren't interested in getting into the Medicaid billing world of things, which is totally fine. And we encourage people to continue their VeggieRx programs as is and develop them as it makes sense for their organizations and their communities. And so what we're thinking is that these quarterly meetings with the VeggieRx Working Group will continue on, and that we can, bring topics and ideas that are unrelated to HRSN, that are still important for these programs to continue to operate and connect with each other across the state. And that really this learning collaborative is going to be kind of a condensed, intense, peer-led collaborative that is really, really focused on HRSN and getting organizations through that process to be able to provide those benefits. So we see this as two different spaces to convene people. But again, that the HRSN Learning Collaborative is really, really focused on just that. And the quarterly meetings will continue to support folks beyond HRSN, beyond Medicaid. All right. I'm going to stop talking for a second and invite anybody else if you've received a CCBF award or have other updates from your organization around HRSN, CCBF, or are totally confused and want to ask this group questions around that. And maybe if I don't see Kiara back on, but hopefully she'll be able to jump back on, or Sarah, if you know any more about that.
I think she's jumping back on, so maybe let's just wait one more minute for her.
Anyone else have other HRSN or CCBF updates from their programs? Oh,
There's Kara.
hi, Kira.
Hi.
Welcome back.
Sounds like perfect timing.
Yes.
How do I? Okay, well, you're not gonna have a video of me. But my update, so we got the CCBF award. It was $194,000 total. It includes about 50 grand for infrastructure upgrades, primarily a walk-in freezer, and electrical upgrades to accommodate that. And then the rest is various staff capacity, going towards navigating the changing nature of the program. I chuckled, Kaylee, when you said you'd like to hear more about the plan behind it, because I would also like to hear more about the plan. And in our first HRSN nutrition benefits meeting last week, they said, I think the verbiage was something like the OHA has committed to pursuing a a debit card, like a benefit card for accessing nutrition benefits widely. So I'm eager to see how that all shakes out. Yeah, so we're getting, the capacity monies up front, and it, is in our best interest and our farmers' best interest that as much food as possible is like going through the Gorge Farmer Collective to Medicare or Medicaid clients. But it's sounding like that part is kind of up in the air.
And Kira, I'm wondering if you can give a little bit of an overview of the Gorge Farmer Collective for folks that might not be familiar with your collective.
Yeah, totally. So we're a farmer-owned cooperative. We're in the Columbia River Gorge region of Washington, Oregon. For the 1115 demonstration waiver, we'll be serving Hood River and Wasco counties. And we're basically like a local food aggregation and distribution cooperative, right? So all of our farmers work together and pool resources in terms of like admin and transportation and accounting and marketing. And so our role is really like we're for profit, just owned by the farmers, and yeah, we get food from the farms to the people, and the farmers can focus on growing food. We've been contracting with Sarah and Gorge Grown Food Network since our inception on fulfilling like VeggieRx programs. So they've been, coordinating kind of like the admin part, and then we are contracted to build food boxes and get them where they need to go.
Yeah, and just to add to that, this year is the first year that Kiara and her team have taken on all of the coordination of the VeggieRx program. So the staffing, some communication with funders, patients, volunteers, and this was a kind of long-term goal to actually pass the program off. And I feel like that's important. Part of how I like to lead a nonprofit is if we can kind of gift a potentially profitable program to farmers, let's do that. So I'm really, really excited, and Kiara and her team are super capable and awesome. And I dragged her into a jillion really boring and complicated meetings about this funding. So I'm really appreciative that she kind of took that risk. And yeah, Kiara, I'm curious, maybe it's still all up in the air, but just one like context for this group is the way we had hoped to organize both nutrition benefits and the housing benefits through this this funding mechanism is having kind of this broader administrative organization called Bridges to Health, kind of take the money and give it to Gorge Farmers Collective and do all the billing and arduous blah blah, which I think is a great model. I don't know if it's going to happen. Do you have any intel on that, Kara?
I don't. They didn't receive the total funding that they asked for, so they're kind of trying to, reconfigure how that's going to work on their end. I think I made it very clear in our application that like I'm comfortable doing the billing and kind of that like admin work, but I made very clear that we're not a social service organization, and like I'm not meeting with patients and like referring them to programs. Like someone else who is already interfacing with patients needs to just send us the referral, and then we can handle, we can get food anywhere it needs to go, but I'm not a social worker. Yeah, so we'll see how that happens.
Mm-hmm. Yeah.
Congratulations. I feel like on a lot of different levels, like you're saying, Sarah, passing this work along and seeing it grow, and Kiara also such an important boundary to set too, of like, and opportunity to collaborate with folks who are social workers or medical professionals that are referring folks on, and seeing that collaborative work happen, that your expertise is in farming and getting food to people, but not necessarily referring folks on. And so it's just really exciting to hear about too, and hope that you all would be interested in being part of this learning collaborative too, as you're like navigating through all of this. Yeah, would love to have your expertise and experience in that group as well. And if there are things that that group can help you navigate and work through, like, I think that's really the idea around this.
I guess I'm wondering if there's anybody from OHA that could be part of this learning collaborative, because I feel like so many of these questions, it's like hard to, like, is there going to be a standardized card? Exactly how is the coding going to work? Or like, I feel like there's only so much we can do as a peer learning without some kind of more concrete direction from OHA.
Yeah, that's a great point, Anna. And I know we've been directly communicating with Julie Reeder from OHA, but I think that there are a few other folks on her team that we might be able to request to be part of those ongoing meetings, or at least maybe on a regular basis, like maybe not every meeting, because I also think that what we've heard from some CBOs is it's nice to have a space that OHA isn't in, to kind of air some concerns and feelings, and then be able to like collect those and communicate them on, but to have a space that feels like free to talk about these things and frustrations and whatnot. But I think that would be a completely possible thing to make happen, to have someone come every other meeting or something. Great. Grace, I think that welcome back. I don't know if you also had or want to share more about CCBF or HRSN in your area too.
Yeah, so my role is the food programs coordinator with Access, which is the community action agency within Southern Oregon. And I'm on a steering committee with Allison within the network here. And she just recommended I hop on this meeting and kind of see what the conversation is around VeggieRx programs. And we're looking at possibly exploring what that would look like within the Rogue Valley. So I'm kind of here just to learn and observe at this point and get a feel for all the work that's being done.
Thanks for hopping on. Yeah. And Marcy, I wanted to welcome your updates too. Maybe this is a good time to talk about IQ Pay and yeah, expanding through that card program.
Yeah, thank you, Kaylee. It's great to hear about everything that's going on and steps being made. So just about the HRSN, it's a little confusing for me since I work for the CCO and for Gobi. Gobi manages the program, and our program is supported through the share funds, which is supporting Health for All through reinvestment, which is mandated by each CCO to have some funds set aside to use for community opportunities to address social determinants of health. So already I have some of these things involved. So like knowing whether we need to register as, like to apply for the CCBF funding and how exactly that works, and how to do it as the Frontier VeggieRx program. So it doesn't appear that the CCO is paying itself, which it's not. But anyway, so a lot more like layers to figure out. Plus, we've been running to get the climate portion started. We're running now to get the housing portion started, which I'm also involved in. And so I don't know that we've necessarily even like started looking at the nutrition part. I think we're going to get the housing done, and then they're going to build the nutrition part, which only leaves 2 months to get that done. So HRSN is a bit of a conundrum for us specifically. IQ Pay, we've been operating the program since July 1st. It has gone really well. There have been a couple of errors just in my understanding of how the card system works, and then me not setting it up in a manner that works really fluidly. So like one of the things didn't click for me is the funds don't roll over from 1 month into the next month. So when you issue like a $30 award, you need to have the expiration date be at the end of that month, as opposed to having the expiration date be 2 months later, because then you can't issue like the next, I can't issue like August now because this one is actually expires at the end of August. So that was my own user error. So there's been some of that we've had to get through. But from what I can tell, people are using it, and there has been so I don't know how much everybody knows about how we do Frontier VeggieRx, but we're only starting this in Harney, Lake, and Baker counties, and we have prescribers in those counties that have the direct client contact, and they have they're the ones that do the eligibility, and then I just handle like the back of the house, paying vendors, making sure everybody's trained properly, and that sort of thing, doing all the reporting. So what I'm finding is having the middleman of the prescriber on issues that come up is a little bit difficult. It would be much easier for me to have direct contact with the participant to fix any issues with their card or accessing it, or like changing their phone numbers or anything like that. That it seems to work the fastest with me having direct contact with them, just like kind of like a customer service number where they can contact me directly and I can fix whatever is wrong. But people are using it in Eastern Oregon. The only store that we're currently using it at is Safeway Albertsons, just because they're the ones who paid for the setup of this program. And there are other stores that are in the network. Like I think Dollar General is one of those stores, and there's some other ones. And I think it has to do with the and I hope I'm really not speaking out of turn here, but the Income OTC network. So I don't know if you'll be able to see this, but on the card on my phone, so it's all done through the phone. But if they can accept this through their system, then they can accept the card through their system. And it's all either on your phone or through emails. The nice thing about it being on your phone is that you can see your balance as you go. And when it's through the email system, you don't get that running balance on your account. You just print off the QR code that gets used in the store, and you have to keep track yourself as to where you're at. But it's been, in my opinion, it has been very successful. I think it will be, I will consider it a complete success when we're able to get it started in our other 4 counties that we're currently in. And when we can use it at all of our vendors, or at least the majority of our vendors, which include a lot of those mom and pop shops that are single stores. So once we get that figured out, I will call it a success.
Thanks,
Marcy?
Marcy. I feel like it's a success just getting this all launched to begin with. So like, congratulations on that too. And really interesting to hear like from your end, even those little nuances of like the expiration date per month. And I know some other folks have been thinking about using the IQ Pay and just like knowing, oh, how do I avoid these types of little hiccups for patients or program participants? Yeah.
I think I heard
Marcy,
someone else was
yeah.
asking a question.
Hi, Marcy, thanks for sharing that information. I'm wondering, can you speak a little bit about how does the technology work so that it is a VeggieRx program, or is it just additional funding to purchase any groceries? I'm a little bit confused about that. Thank you.
Yeah, no problem. So it is the Frontier Veggie RX program. So it is only for fresh or frozen produce with no additives in it. People are identified in our 7 of the 12 counties that we serve by answering often true or sometimes true to one or both of the food insecurity questions. And then they are considered eligible. They do not have to be an EOCCO member in order to participate, so they do not have to be on the Oregon Health Plan. However, what we're finding is it's about a 50-50 split in people who are on the Oregon Health Plan and people who have either private insurance or no insurance. But they find out about the program at the local level through friends, through neighbors. We have not done any advertising for the program because we fill up very quick. We do re-enrollment on an annual basis, and we do surveys. The survey is embedded in our enrollment form. So for people who have participated in the program before, they answer those questions, and then we compare their answers year over year as to how the program is doing and whether it's being successful or changing in their perspective, their health, etc. We do have a tracking form where I track the 11-15 waiver transition populations. We also, I'm going to this next year embed the social determinants of health assessment that CCOs are required to have their providers do. So I'm going to embed some of those questions, not all of them. We do have some of those questions already in there, but it's not quite worded the way that an official assessment should be done. And so we operate through clinics, public health departments. However, we also work through community-based organizations, through county family services in one county. And then in another county, we operate through a volunteer and through the local community health partnership, which is an LCHIP for our area. So we have like the full gamut of who prescribes, who the vendors are, and etc. However, the basic program is the same across all the region, all counties. Did that help clear it up?
So I am still, that's amazing and really helpful information overall. With the card that you improved for
So you're breaking up a little for me. I don't know, is she for everyone else? Okay.
Yeah.
So
I think
will.
that the question might be around it. Does the card, can you only use the card for fruits and vegetables or like specific types of foods? I think
Yes,
be what she's
I
asking.
think I that's what I was gathering as well, Kaylee. So thank you. So the IQ Pay has several different tracks, I guess that's what I call them, that you can have. So they have the particular one that we have is a track that is only has the UPC for fruits and vegetables, for produce. So when they go to the store, let's say at Safeway, there is a QR code that is on the card, and you scan that with the little scanner thingy, and it then, when you check out, takes off the cost of the produce. What's really cool about IQ Pay, I think, is that they also have like a diaper track. So if your organization wants to be able to provide funds for households to purchase diapers, you can get a card that's specific for that. So your organization, it will only have and approve the UPC codes that have to do with diapers and wipes. And so they can kind of build tracks for whatever your organization needs. It might be a little maybe in the future, but those are the two that I'm aware of right now. So it looks like there's a message that IQ Pay does offer an all groceries option.
And Megan, if it's helpful, we do have a recording of like a presentation that we did, that IQ Pay did with Safeway and Marcy with the Frontier VeggieRx program. So happy to send you on that link. And it gives even more detail about the IQ Pay system and how you're able to use it. And as Anna mentioned, there's like, there are like, depending on how much money and budget you want to pay for the system, there are more like individualized, customizable features to it. It sounds like basically anything can be customized. Yeah, Marcy.
Yeah, so this is what I think some of the HRSN funds can be used for, is for that technology portion and the building of your platform. And so I think that might be something that if you have an opportunity to apply in the future, that if you're wanting to go to a card system, maybe that might be a really nice route to go with for doing that. So that, I think it would be a nice marriage of funds.
I know we are at the top of the hour, and technically this call we're going until 10:30, but I'm seeing people drop off as other meetings are coming up. The rest of this time, and thank you, Marcy, for sharing all of those updates too. It's really helpful to get the insight on that. And Anna, I know you've been looking into this a lot too, and wanting to implement the IQ Pay system for your program as well. For the rest of this time, we kind of wanted to get a little bit of a pulse check on how we want to finish out 2024 and going into 2025, what people are hoping for, and recognizing that some of the things that we've been able to do as a working group in the past are things like joint evaluation, thinking of like a common evaluation set of questions that programs across the state, no matter like who's running them, can use those evaluation questions, and compiling that data together to look at the impact across the state. So I know sometimes we don't start talking about this until November, December, and programs are like, yeah, we want to do this, but we really need those questions like January 1. And so we wanted to bring that up as like, do we want to start collaborating on that now to be more prepared for the new year? Another thing that we've done in the past is do a whole statewide census of what programs currently exist and how they operate, their program structure, and like how many FTE do they dedicate? what kind of a benefit is it? Is it a CSA model? Is it a farmer's market voucher? Is it now a card system? What kinds of outlets or retailers is that usable for? Which can be a really useful collection of like seeing that collective impact over the state and what type of programs exist and how to contact them and getting ideas of other program structures. Another thing that we wanted to mention too is there are resources on the OCFSN VeggieRx webpage that have the census, that have evaluation report on it and other resources, but we also have a whole drive within OCFSN to have different like toolkit examples and other content that programs are willing to share that that other programs can source that information or like see a template of their policies and procedures or a manual or a handbook or things like that, so that people aren't having to reinvent the wheel. Jen Coate, who was doing a lot of work for this working group, she's working on doing like a little video tutorial of that Google Drive of all of those resources and how to access that and how to like navigate through that. I can share screen really quick. Let's see if this is the right thing that I'm sharing. Let's see. Can you see this Google Drive? Yes, cool. Okay, so this is the OCFSN VeggieRx Working Group files. So you can see, you can access the strategic plan here, monthly meeting content, including notes and agendas and things. And then this is VeggieRx toolkit samples. I'll click on this to show you like recipe templates, these VeggieRx logos that we had talked about previous. Oh gosh, here we go. See, now I need a tutorial on how to navigate through all these. There's some other archive documents in here, the census report, statewide final summary of statewide VeggieRx programs 2019. Like some of these things are a little bit more outdated, but as you're talking to potential funders or whoever you might be talking to that you want to share this information, there is a whole repository for this. And if you have toolkits or sample documents that you want to share with the group, that's also something that you can like upload and put into these files to share. So we'll put out a little video of how to access all of those things and like how, if you're not a huge Google Drive user, like how to navigate those resources. So yeah, if we want to use the remainder of the time or however long people can stay on of like, what do you think would be most useful to you and in your work and goals, and what keeps you showing up to these meetings? How would you like to spend the rest of 2024 together?
I can just share a couple things that are on my mind as I work through all this. One is an opportunity that we are going to be overseeing a nutrition grad student to do a year-long project on trying to figure out what types of nutrition supports different CCOs offer around the state. So, obviously there's the 1115, but even beyond that, like through the flexible services, what are the eligibility criteria for what different types of nutrition supports? But when you're talking about a statewide census for VeggieRx, there might be opportunity to kind of fold in some of those questions into the interview guide that she'll be developing. So let's stay in touch about that. And then Kayla, I know you and I have talked a lot about this, but just to kind of bring it with the whole group, one of our main barriers right now is our hospital administration saying that we need to include any food supports as taxable income, essentially, for those recipients, so they want to send them a 1099 form. So we've been doing a lot of research around the country around why we don't believe that's the case. But my goal for the year is to get some final clarity on that and how VeggieRx type programs or broader pantry stocking programs fall within the IRS understanding of what is compensation, what is not compensation. So those are two of my kind of bigger picture things going on.
Thanks, Anna. Anyone else? All right. Well, we won't take up any more of your time. I think maybe we'll take some of those ideas, throw out some ideas to the group, and look at, we'll have one more quarterly meeting, most likely in November. We originally thought that OCFSN was going to have an in-person convening for all working groups across OCFSN. And just with Shin being on medical leave and Andrew's actually going on family leave, he's going to have a second kiddo here soon. There's been a lot of kind of less capacity this fall to organize that. And so we're not planning on having an in-person thing this fall, but virtual sessions are very much available. Oh, can't unmute Amber. Okay, but someone from a national org, I'm happy to provide connections and or resources for that level. Great, thank you, Amber. Yeah, and Amber is with Healthcare Without Harm, if you don't know Amber. So thanks for being on the call today, and I'm sorry you can't unmute. Great, well, Claire, did you have any other follow-up questions for the group or anything that you think might be helpful?
You know, not off the top of my head. I think that we were really wanting to make sure that our quarterly meetings were meaningful for the group that shows up consistently, especially beyond that kind of HRSN piece. But I think that input from you, Anna, was helpful. I don't think I have any follow-ups.
All right, y'all. Well, be well, stay healthy, eat your veggies, and we'll be in communication soon. And you'll probably see many more emails about the HRSN Learning Collaborative and kind of more details as those come available. But really appreciate your feedback too on kind of thinking through structures and also if you do have folks in mind of organizations that might be able to take on a few more hours of FTE to help coordinate something like that, that would be fantastic. We're all ears. So yeah, thanks y'all.
Thank you.
Thank you.